Hi, today we are going to see about cardosynthesis. See the definition of cardosynthesis. Cardosynthesis is also known as percutaneous umbilical blood sampling. It is a diagnostic prenatal test in which a sample of the baby's blood is removed from the umbilical cord for testing. So already we have seen about amniocentesis. This is same procedure like amniocentesis, but here the blood is removed or taken from the umbilical cord of the fetus for diagnostic test. This is known as cardosynthesis. So it is a diagnostic prenatal test in which a sample of the baby's blood is removed from the umbilical cord for testing. Synthesis, which is usually done after week 18 of pregnancy. Use of cardosynthesis is becoming rare because diagnostic procedures such as amniocentesis and chorionic villi sampling, which pose a lower risk of fetal death. So here cardosynthesis is done very rare because it has high risk for the baby. Cardosynthesis is usually done when a diagnosis can't be made from amniocentesis, chorionic villi sampling, ultrasound, or any other methods. Cardiosynthesis carries a high risk of complications to the baby, including death, than other procedures do. So, this procedure is done after 18 weeks of pregnancy when it is very difficult to diagnose in any other procedure such as amniocentesis, chorionic villi sampling. In those cases, this cardosynthesis procedure is performed. Since it has a higher risk rate, it causes death for the fetus. Next is the indications. Cardosynthesis is used primarily to detect and treat blood conditions such as fetal anemia. So, anemia is a low amount of healthy red blood cells in a developing baby. It can be used to detect certain genetic disorders, blood conditions, and also infections. Cardosynthesis can also be used to deliver blood and medications to the baby through the umbilical cord. Cardosynthesis might be used to check fetal chromosomes through chromosome microarray or karyotype analysis. Blood obtained through cardosynthesis can also potentially be used for other types of genetic studies. So here the main indications to detect fetal anemia, that is less amount of RBC in the developing baby, and also this cardosynthesis is useful to detect any genetic disorders, any other blood conditions, and also to diagnose the infections. So this is about the indications. Next, we can see the risk of cardosynthesis. So, what are the risks may occur for the baby due to this procedure? First one is fetal bleeding. Bleeding from the area where the needle is inserted is the most common complication. If life threatening fetal bleeding occurs, replacement of blood products to be done to the fetus. So, here the puncture is done in the umbilical cord. So, due to that, there may be continuous bleeding. If continuous bleeding occurs, replacement of blood products may be done. So this is one of the risk factors, that is fetal bleeding. The other one is called hematoma. So hematoma is a collection of blood. So a collection of fetal blood within the cord might occur during or after cardosynthesis. Most babies don't have signs or symptoms when this occurs. However, a few might develop a lower heart rate for a short period. If your baby's heart rate doesn't recover, an emergency cesarean section is done. So this cardomatoma is a risk factors for cardosynthesis. So after this cardosynthesis procedure, some babies may develop low heart rate. So it may recover after some time. Suppose if the baby's heart rate doesn't recover, an emergency cesarean section is done. Risk factors are infections. Rarely, cardosynthesis may lead to a uterine or fetal infection due to the introduction of a needle through the abdomen. It causes infection if we are not maintaining aseptic procedure throughout the procedure. Then fetal maternal bleeding. Fetal blood might enter maternal circulation in about 40% of procedures. The amount of bleeding is usually small. This problem is more common when the placenta lies in front of the uterus. So, when there is a mixing up of fetal blood with the mother, it causes some complicated reactions also. So, fetal maternal bleeding is also one of the risks for the mother. Then passing maternal infection. If the mother has certain infections such as hepatitis B, hepatitis C, or HIV, they might be passed to the baby due to the prick. Okay, so this is also a risk factor. Then pregnancy loss. Cardosynthesis carries a higher risk of fetal death than do other procedures such as chorionic villi sampling or amniocentesis. The risk is about 1 to 2% for a fetus that appears normal and is being tested for genetic disorders. So there is more chance for pregnancy loss in cardiosynthesis when compared to other procedures. However, since many babies are ill when the test is done, it's often difficult to determine whether fetal death is related to the procedure or to the baby's health. So the test done, that is cardosynthesis, that is performed for the baby, most of the babies will be sick only. So only they will be recommending this procedure. So after this procedure, some babies may die due to the risk factors of this procedure or maybe due to their illness. It is not clearly understood. So these are some of the risks that occurs due to cardosynthesis. Next, we can see how to prepare the patient for cardosynthesis. So if you are 23 or more weeks pregnant, you will be asked to avoid eating or drinking after midnight the night before cardosynthesis. This is because certain complication caused by the procedure might require an emergency cesarean section. So the previous day from midnight, the mother should be kept nil per oral to avoid any complication because the procedure may sometimes cause risk for the fetus. In those cases, emergency cesarean section is performed. So for that, we have to prepare the baby mother in nil per oral status. What can you expect? So, before weeks 23 of pregnancy, cardosynthesis is usually done in an outpatient facility or the healthcare provider's office. So, if the mother is less than 23 weeks, it is done as a outpatient department. After 23 weeks of pregnancy, cardosynthesis is usually done in the hospital in case the baby develops complication that might require an emergency delivery. So if the mother is above 23 weeks, it is done as a inpatient procedure because if any complication arises, they will be going for emergency delivery. Suppose in case less than 23 weeks, there is no use of doing cesarean if there is any complication also. We cannot save the baby's life. So due to that reason, before 23 weeks, it is done as a outpatient procedure. After 23 weeks, it is done as an inpatient procedure. A sample of your blood will be taken before the procedure for comparison with the fetal blood sample. So here the mother's blood sample will be collected to compare it with the fetal blood samples. During the procedure, about 30 to 60 minutes before the procedure, the patient might be given antibiotics to reduce the risk of a uterine infection. An ultrasound is done to determine the fetal heart rate, umbilical cord location of the uterus. The patient will lie in supine position. Clean the abdomen using antiseptic solution. So here the mother is first given antibiotics to reduce the risk of infection. Then an ultrasound is done to check whether the baby is alive. If the baby is alive, then the umbilical cord location is seen through the ultrasound. Then the abdomen should be cleaned using an antiseptic solution. By ultrasound, insert a thin, hollow needle through the abdominal wall and into your uterus. So you can see the picture how they are inserting the needle. Okay. A small amount of blood from the vein in the umbilical cord of the fetus will be withdrawn into a syringe and the needle will be removed. So here, using the ultrasound guidance, they will insert a thin hollow needle through the abdominal wall into the uterus, then into the umbilical cord. Then they will withdraw the sample. The patient might notice a stinging sensation when the needle enters the skin, and you might feel cramping when the needle enters into your uterus. So, when there is any prick, we will be having that stinging sensation. So, the same thing will be felt by the mother here. Then, after the procedure, so after the blood sample is taken, the client might have cramping or a small amount of discomfort. It is considered to be a normal one. Then the baby's heart rate should be monitored after the procedure. Then the client would likely be able to resume normal activities the next day. So on the day of procedure, she has to be in rest. She has to resume her normal activities from the next day. Call your healthcare provider if you experience any vaginal bleeding or fluid leakage. Then the blood sample will be analyzed in the lab. Test results are typically available within the days based on the test what they are going to perform. So this is the aftercare of the procedure. We can see about the results. If the test results are normal, your healthcare provider will discuss the need for any follow-up appointments. Because in the earlier, that is around 23 weeks or before that, we cannot identify anything properly. So in those cases, after few weeks, they will give for some other appointments. If your baby has an infection, your healthcare provider will explain the treatment options. If your baby has any severe anemia, he or she might need a blood transfusion through the umbilical cord. If the test results indicate that your baby has a condition that can't be treated, options will be given by the doctor, such as to continue the pregnancy or to discontinue. So, here the healthcare provider has to teach the client or the couple about the risk factors for the baby, whether it is a treatable one or not treatable. We have to give the suggestions to the couple. Based on that, they will select the options whether to continue the pregnancy or not. This is about the results of cardiosynthesis. So, as we have seen earlier in the risk factors, so the same thing will be discussed here. So, the complication that occurs after cardiosynthesis is fetal death, bradycardia, amnionitis, that is infection of the amnion, cord hematoma, that is accumulation of blood in the umbilical cord of the baby, umbilical cord bleeding, fetal maternal hemorrhage may occur, then premature rupture of membranes may occur, then preterm labor, then abruptio placenta, that is premature separation of placenta, maternal sepsis followed by adult respiratory distress syndrome, then risk of emergency cesarean section based on the condition of the baby, then failure to obtain sample. So these are some of the complications that may occur due to this cardiosynthesis procedure. Hope you have understood the topic, the definition, and also the risk, what are the things we can diagnose through cardiosynthesis, then about the procedure, about the aftercare of the client after the procedure, then we have seen the complications. Thank you everyone.